today we're going to do just like a quick demonstration talking a little bit about something that a lot of coaches and athletic trainers will use for injury prevention, which is external stability or taping. So I'm going to have you watch out for the mic right behind your head, and I'll have your foot this way.
Can we sit right here?
Yeah, this way though.
This is the thing right here.
That's fine. So I'm going to talk about two different types, well three, but I'm going to showcase two different types of tape today. The first that we're going to start with is kinesiology tape or KT tape. This is a very flexible type of tape. So when we're talking about injury prevention, this is going to provide a lot of that proprioceptive feedback that athletes need for that injury prevention and then on the field, but it's not as rigid as something like white tape, which we'll move into next. So I'll have you scoot down to the off table. And so I'm going to showcase both of these on the ankle. The cool thing about tape is that it can go anywhere in the body mostly. KT tape provides us, again, a lot more range. So we're not going to provide or pop something as like stiff and rigid as white tape up on the shoulder because it's a very mobile joint. KT tape, you can. Similarly with the ankle, the most common ankle injury that we see is a lateral ankle sprain. It happens in all athletic participation. And so what we're going to do first is provide some structural stability and some proprioception into preventing that lateral ankle sprain. So we're talking about lateral ankle sprain or inversion ankle sprain. This is our typical movement that we're trying to avoid. So we always start in flex position, always pull a little bit of stretched tape, and then we're pulling into the opposite direction of the injury. So if it is an inversion injury, keep it flexed, we're going to pull into eversion. Now again, very, very flexible tape. The more that you're stretching it, the more proprioceptive feedback that it's providing. That doesn't always mean that we want to necessarily crank on it. But now, watch your foot, you can see we're not moving in as far, but she does still have some range here. Now, we're going to do our second piece, which is a heel lock, which you'll see these same structures in when we do the white tape as well. It's kind of copycatting between the two, but using the different style of tape provides you different feedback. So here, we're doing what's called a heel lock. All on that lateral side again. And I'm just doing a half heel lock here. But again, always pulling medial to lateral. And now, if we relax, we have even more structural stability here. But the cool thing about this, she's still able to move. So this is really great for our dancers, our gymnasts, our divers, because you can't put tape in the water, but you can put tape in the water, or athletes that need just like a little bit more motion and don't want to be as rigidly supported. However, ankle tape, our standard, very classic white tape, is what we typically are seeing in the athletic training room. Now, this is something that a lot of coaches require and are asking all of their athletes to get their ankles taped. I personally believe that that needs to be in conjunction with exercise. So me throwing some tape on your ankle and then sending you out on the court, yeah, it's going to lower your risk of potential for an ankle sprain while you're out on the court. You take that off the second the game is over, your risk is right back there. And your body is not strengthening its proprioceptive feedback while you're on the court because the tape is doing it for you. Rachel.
Can you elaborate a little bit on proprioceptive feedback?
Yeah, so proprioceptive feedback, proprioception is your body's awareness in space. And so when you're standing, your body is aware of where you are in space. When you balance and you close your eyes, that's why it makes it more difficult because you're taking away one of your proprioceptive feedbacks. Your feedbacks are your Golgi tendon organs, which are your muscle structures, your tendon muscles, your inner ears, and your eyes are your three structures that are providing you proprioceptive feedback. And so when we can help them out, in this case, your muscle structure, you're helping them kind of organize and be a little bit stronger without actually having to do a lot of the exercise, which is why it's important when you take this tape off or before practice or before activities, we're wanting to do those exercises to actually strengthen those muscles, strengthen those features, strengthen your balance without relying on tape. Cool? All right, and you'll see the same structure here. Typically, we're not overlapping these things. They're two different things, but I'm not gonna whack it down here. So, again, medial to lateral. As you can see, this is a little bit more involved. It's a little bit higher up. It's a little bit tougher. And this tape doesn't stretch at all, which means once we're done here, she's gonna be a lot more locked in than she was with the KT tape. How did that KT tape feel?
A lot more loose.
A lot loose. Yeah, which sometimes is positive. I really like to use KT tape on the shoulder as well for postural feedback, because again, we can't throw a lot of white tape on the shoulder, but for KT tape to get us down and back, get us in positions that are really positive for us, that's something that's really helpful. So you saw here we did those two same stirrups, very similar to what we did with KT tape, again, just a different structure. And then this is the same idea with that heel lock, except now we're doing it with white tape. This one is a double or full. And then you just close her up. Now, this is also something very similar to rehab that is not even across the board. Anytime I see an athlete, especially from a traveling team, I ask them first, just standard? Because some athletes need things that are different. There's figure eights that you can do. There's additional Achilles support that you can do. Each athlete is going to have a targeted approach to what they need. This is a pretty standard ankle tape across the board because it's providing her that support that she needs. She's not going as far as her anatomy would allow her typically. And she's a little bit more locked in here, a little bit more structurally stable, which is going to provide you some injury prevention, again, alongside therapy, rehab, and strengthening. Questions? Yes?
So when I was in college, we were working with two physicians who would do ACLs, and their approach to like bracing and taping was very different. One of them was like, I don't need them to wear the big giant bulky brace, I just want them to wear some sort of proprioceptive feedback.
Sure.
The other one was like, no, I need to mechanically change that.
Yeah.
So I guess the question is like, where do you like line on that, and where does the rehab come in with that?
Yeah.
I feel like for me, like in athletic training, that proprioceptive feedback and that like neuromuscular feedback, that's huge if we're returning athletes in a shorter amount of time than it would actually take to build the strength.
Yeah, and that's why you need that quantitative testing to be able to make those decisions as to when are they structurally strong enough to return to the field safely without any external support, like bracing or anything like that, versus when are we still lacking in our strength and in our proprioception and in our stability and change of direction, and we're still needing a little bit of either biomechanical feedback or actual structural stability. Those like sports specific like hinge braces, they're pretty tough. You're not shifting in any direction as heavily as you would before, both medial lateral and anterior shift. So those are things that, again, it is very surgeon to surgeon specific, but in order from a physical therapist and athletic training standpoint, what we need to provide to the surgeon to say, hey, it's time, is like very concrete measures of, we did this testing on both sides using things like our apps and our force plates that we were talking about in the previous panel to provide actual numbers and evidence that that patient and that athlete is ready to progress onto the next phase of performing in sports safely without using additional structures. Similarly, things with like the ankle brace, it's very common in like linemen and football players to have those like ASO braces. And if you look at them, the structure of them is literally this, but just with straps. It's very, very similar. And again, there are a lot of teams that require the whole front line to have bilateral ankle braces on, and that is because they are at a high risk, but taking those off and then just going and living their life without providing them actual ankle stability through strengthening through exercise is not doing them as much benefit as just slapping a brace on and telling them to go for it, because now they're protected. Because the other thing as we're talking about athletes is they're also people. They go out and they live their lives off the field, off the court. And we see a lot of injury happen in those times as well, that I think a lot of times that gets neglected. And so who's to say that they are not out and about in their daily activities, step in a hole, roll their ankle, what's the difference between that and on the field? And they're not wearing their ankle braces when they're out grocery shopping and living their life. They need their bodily stability to be able to be successful on and off the court and field.
So I got a question.
Yeah.
And like, I guess the new age, they say in technology, I was always taught, playing the NFL, you gotta get your ankles taped.
Yeah.
Right? So now, did you ever ask that?
No, I was just telling him, so, from my
Yes.
you're gonna take it regardless.
Right.
Injury or not.
So what I'm hearing now is that, listen, no, you shouldn't get taped, it weakens your ankles.
Yeah.
Right? This is from a high school level.
Sure.
I haven't heard on the collegiate level.
Yeah.
Now, from high school all across the 804, I'm hearing,
Yeah.
trainers saying, no, you don't get taped.
Yeah.
I don't know if they'll study on that or whatever. I'm not really believing it, but can you elaborate on that?
So it is a preventative technique, right? So you taping your ankles in the NFL, everybody getting their ankles taped, that is lowering your entire team's risk of ankle injury, right? But that alone isn't going to cut it, right? And so when we're talking about the holistic athlete, when we're talking about patient-centered care, it's not just on the field. And a lot of times, placing tape and external structural stability, it can just be a Band-Aid on an issue. And so you need further rehabilitation, further strengthening to make sure that that is a concrete thing when you're taking that tape off. Because in reality, I tape your ankle before practice, you go out and practice, you come in, you cut it off, and it's done. What is that doing for outside of practice? And it isn't actively, while your ankle is taped, those proprioceptive feedbacks aren't being strengthened in the way that they are when you're not taped. So that's where the research comes from.
So that's stronger than, and we all know as being an athlete or also a person, that the mental is the most strongest thing. So if I know from a standpoint that this is actually strengthening and protecting me, wouldn't that, and I believe why the NFL and collegiate level, why they still demand it, because it strengthens the mental when you believe that's going to be safer.
And it is safer. You do have external structural feedback that is happening from the tape, which is why a lot of coaches and a lot of levels will require it. But again, that can't be the only solution. When we're talking about true prevention, putting an ankle tape on you isn't the only level of prevention. There has to be something beyond that. Yes?
So she also talked about if you lock that joint up, okay, and you injure, and that joint prevents movement, then the next joint is going to be affected.
Exactly.
So if you lock up the ankle so much every day, and then you don't have proprioception, you're going to hurt your knee.
Yeah, exactly.
So the ability, we use low top shoes because we want to build the strength in the ankles. You're going to step on foot, you're going to roll it, but the stronger your ankle is, the quicker you come back.
Exactly. And if you're relying on tape as your strength rather than your muscles and your joint stability, then you're setting yourself up for a disadvantage. Yes?
All right. How you doing? My name is Adrian. I run a semi-pro football team, and my son also plays football. And the question I want to ask, what's the difference between the actual taping up the ankles and the ankle brace?
Yeah.
When I was in high school and college as well, I wear the ankle brace, and somewhat works for me. But now I see most guys, they want to get booed up, they want to tape all the time. So which one is better? Which one would you recommend?
So it really a lot of times depends on your resources. So that's the other thing is sometimes when you're at football camps, when you're doing private training, you're not always having access to an athletic trainer who has been formally trained in how to do this tape job so that it ends up safely. If you do this wrong and you still roll your ankle there and the tape is not sitting in the right spot and someone just kind of throws it on because they watched a YouTube video, there's potential for like fifth med fractures, there's higher risk for high ankle sprains, there's potential if it's done wrong. An ankle brace is a very safe bet of if you put it on and do the 4 straps, you're kind of set. Rather than this that takes a lot of practice and the angles have to be correct. And so it's a little bit more of like a foolproof way when the resources aren't as available. And this, I would say, is a little bit just like more rigid to begin with, but as you sweat, as it's hot, it does stretch a little bit. So sometimes kids will be like, that's way too tight. And I'm like, well, in 20 minutes it won't be. And so there's that conversation as well. The brace doesn't do that as much. So there's pros and cons to all of it that don't necessarily lead to one necessarily being better than the other. Again, all of them are still going to require that non-braced, non-taped strengthening.
Thank you.
Yes?
The question is, what is the mechanism of action of tape? It kind of goes back to your section. So it does provide some like structural support to the ankle.
Yeah.
But also, just having that tape on there, it gives it more proprioceptive input. There's a research on that basically, can they become dependent on the tape for the proprioceptive input.
Yeah.
And you want to train it in and out of the tape.
Exactly. And that's kind of what I'm saying about when you get off the field, that tape comes off and then you go through your daily life, you're still requiring proprioceptive feedback. And if your body is only being trained in change of direction and in breakdowns and in all of those things that require our muscles and our joints to stay stable while they have tape on them, your body becomes reliant on that. And so it's important to do some of those exercises safely, especially like post-injury, not relying on the feedback and the structure and the stability from the tape, but rather your own body. And that's what's going to set you up for success so that you can pick up a little bit faster. You're not required to have an athletic trainer on site and you're still able to perform, as well as providing you longevity in your career as well as in your life. Because again, you're not going to have someone around all the time taping your ankle for you to go and play with your kids and do other things that are really important for your joints to be able to participate in later in your lifetime.
I would love to see that. I think this is a study that should, okay. I'm sure, I think it's a study that needs to be done. I have this all the time.
Yep.
And just from professional standpoint, it's mandatory that you have to do it.
Yeah.
And I know they put a lot of money into research, looking at it, but I know from all other perspectives, people say, no, you don't need to wear tape. I would love to see that. I don't know if it's a study that's been done.
There's a good amount of research that's come out about it, about what it means in the long term, how it is actually helping when the patient is untaped, all kinds of things. So there is more research coming out and things are always going to change. So, you know, what we did 20 years ago, we didn't have force plates and KT tape, and there's a whole bunch of emerging technology to help athletes succeed. And so it's an ever-changing world. We just kind of all have to try to keep up.
Got one last question, because we got to.
I would also argue to that point too. So you're talking about your NFL guys, you're talking about your college guys. Those strength and conditioning programs that they have access to are in conjunction with their sport science teams and other positions that are probably putting a lot of that work that she's talking about into their daily routines and their daily workouts that they're doing. So even though they're doing that, I think they're probably also doing other stuff on the back.
I would tell you that you would think that. That's not
That's what I was just about to say. It's not true.
You would think that. That's not.
You would
Being
hope.
in that
I would
is-
hope that.
Yeah, you would think that. You would hope that. In the NFL, there are 4 or 5 guys on the roster that they care about, and then everybody else is a beer can. Meaning when that beer can is empty, they just go get another one. Right? So, like, I think this is why this thing is important, because everybody can see their role here.
Yeah.
Like, our role is to help get that angle stronger and more functional. If somebody gets hurt on the field and they were on tape, that athletic trainer is now getting fired because that person wasn't taped. So that's why that rule exists, that hey, everybody's getting taped because I'm not getting fired because you rolled your ankle. You see what I'm saying? So there's a lot of that, and I think a lot of that is taken for granted that, oh, these guys have access to strength and conditioning coaches. What you don't see is those guys are actually coming to people like us because we're doing the job that was supposed to be happening at that strength and conditioning program, but it's not. And it's not because that strength and conditioning program is bad, it's because they have one guy in charge of 100. And there's no way, right? So,
That makes sense.
yeah.
And there's also limited hours in the NFL too.
Exactly, yeah.
And I think you get about 40 hours in the NFL.
I want to see the new study. You guys do it.
I'll send you the link. Thank you guys.
Great job, everybody. Great job.